What we see with teenagers and depression in teenagers is that it might be kind of the first time that we begin to see a mood disorder. And with that, we might expect to see a lot of certain types of things. So in teenagers, what you might see is you might see a change in behavior that indicates that there's depression there first. Really, when we're thinking about depression and kind of different types, it would be kind of like, is it mild, is it moderate, or is it severe? And so depending on maybe what those behaviors are, would be kind of what you would maybe look at, as far as what type it might be. The major depressive disorder is kind of what we typically see, which is like, that you might have a kiddo that was really wanting to be in activities before, and all of a sudden they're not wanting to engage in those activities anymore, and a lot of other symptoms and stuff that might go with that. And then with the persistent depression is maybe more of where they've sought treatment and you've tried some things. But that depression is now, it's not cyclical in nature. It's like just a constant state of being. And so the persistence piece of that is that even like with maybe medication or with, having a therapist, those things that persistence kind of keep coming back. And it's a little bit more of a chronic type of expression of depression. It's not uncommon for parents to have a child or a teenager who's pretty moody, and as parents, we can get really anxious about the well-being of our team, and so what are the things that we want to really pay attention to that make sense for the difference between just a mood swing and something that might indicate that there's a bigger problem, like a major depressive disorder. And so really, I think that one of the things is duration. How long are we noticing this change in mood? For a teen, they might go through a breakup or the end of a relationship, or something else might happen in their life where they feel sad, and they might feel sad for a week or 2 weeks. We're going to really want to start paying attention to it when we're noticing that this depression is moving more towards like 3 months. So it's been months on, and we're really beginning to see that that depression is a longer period of time, that duration. So 3 months or more of that sustained level of not wanting to participate in things, maybe appetite changes. We're noticing changes in sleep patterns. We might notice irritability, increased irritability, and it's for a marked period of time, which is at least 3 months. The other piece we want to pay attention to is severity. There's, just having the blues. I think in the wintertime in particular, when we're not getting as much vitamin D, it's not uncommon for people just to feel a little low. And so it goes beyond just feeling a little low into the place to where that we're really seeing behaviorally a lot of differences. And so if you're just feeling a little low, you might still be able to go to school. They might be able to take a test, and they're still passing. Their grades are doing okay. They're doing fine. Not much of a change. That intensity of the depression, we can begin to measure it. We know it's more of a problem if we see a decline in the teen's ability to concentrate and do well with school over time, with tests, and maybe even we notice a lack of attendance. It's really beginning to become more consistent over that 3 month or more period of time. And now we're beginning to see a lot of different areas where that functioning is going down. Particularly, we see it in school first. We might also see it in friendships, where at one point they used to really enjoy socializing and interacting, and now we're noticing that for a distinct period that they're not wanting to go out and hang out. They're not wanting to engage with their friends. Or maybe they're engaged in an activity, and now we're noticing a really marked, significant impact on their ability to do that activity. So maybe some emotional things, behavioral things to pay attention to would be school. So are they attending school? Or are they not attending school? You look at how are they doing in their relationships? Are they reporting having a lot of conflict in their relationships? Does it feel like relationships are going well? You might even pay attention to the level of healthiness in those relationships. Are the relationships that they're drawn to and attracted to with people who are in a healthy, well-balanced place in their life, or are they more drawn or attracted to people who other teens who might be struggling as well? And their communication is focused on that. You might also notice a change in appetite, either sudden gain or sudden weight loss, gain or loss in weight. And you might also notice a change in their ability to get restorative sleep. Either they're sleeping way too much, and by the way, teens typically in the teenage physical development, they probably need anywhere between 8 and 10 hours of sleep per night. So either they're getting far less than that, or they're sleeping way more than 10 hours. So 12 hours plus that we're looking at. Or now we're saying, okay, this could be a marked depression. Teens do need a little bit more sleep than sometimes that they're even willing to give themselves. But it would be normal, particularly if they're in a growth spurt, physically growing. There's a lot of mental stuff that's happening as well as far as development and intellectual development. And so the brain needs that time to sleep. So kind of normal for 8 to 10 hours. And if we're seeing more than that, then we probably need to be concerned. Absolutely, that could be. Oftentimes we see teens. It's easy for us to go to maybe a diagnosis like oppositional defiant disorder or a conduct disorder, and we want to be really careful and say, did this start? Was there a time where they weren't maybe oppositional, or they were, they used to be not irritable. They used to follow directions. They used to be able to engage in a conversation. And now, like looking back on it, I can see this time where my teen began to really struggle with irritability and anger. And then we can say that it's likely and can be that irritability and anger are very much a part of depression. And so more and more, it's a little bit easier for us to maybe show irritability than it is for us to really be able to talk about how sad we feel or how hopeless we feel. So it's not uncommon, particularly for teens, for that depression. Some of those first signs and maybe those early signs of marked irritability and irritation, agitation. You think about it, from a person who's experiencing kind of a lack of pleasure in life in general, probably be pretty grumpy. and typically the people that are at the front line of that are going to be caregivers and maybe other people in the family, siblings, that sort of it. So once again, it can be normal, right, for within the family system to experience some irritation and agitation. So what we're looking for is that marked change. And you might hear your teen saying something like, "Oh my goodness, I don't want to feel so irritable, and I'm feeling frustrated and angry all the time." If we hear our teens saying that, then we might want to ask some other questions about what's going on with them. There's sometimes some confusion between isolation and maybe taking some time to find some healthy solitude. And so how do we tell the difference between somebody who's seeking solitude, which could be a time of reflection, a time of rebuilding our energy, and isolation? which would be something that's more consistent with depression. And that would be that really, once again, that marked level and duration of and significant severity of they don't want to connect with anyone. And so it might be just staying in their room all the time and never coming out. And the big word there is never or almost always not coming out, right? And so that's what we want to really look at. One of the things I think it can be hard is that today there are so many different kinds of electronic devices and things like that where it's easy for us to stay in our room and stay on our phone or watch TV or stay on the iPad or tablet. And so sometimes it can be an indication of something else. And if we're noticing that marked change where they used to be really social and now they're not wanting to engage at all, that would be what we would be looking for. So once again, it's looking at that friend group. Are they talking about, are they wanting to hang out with their friends? For teens and teen development, this is a time where social energy and having time with that is a very large part of the development of a teenager into young adulthood. And so if we're just noticing that just isn't happening, we should start to maybe ask some questions and want to find out if they need some additional help. I think sometimes we don't want to ask a question as a parent because we're afraid that we're going to make it worse. And they might give us a little attitude when we do it. And I think it's really important that we remember if we're coming from that compassionate, caring place and recognize and say, hey, I'm noticing that it's really hard for you to come out of your room today. And I'm really wondering, I really care about you. I'm wondering, like, what's going on? Is there anything going on? And they might, respond with, nothing, Dad, or nothing, Mom. Fine. You say, okay, I hear that. I respect that. And, just know I'm probably going to be asking you that frequently to see how you're doing. I'm here for you. I'm here for you and ready to talk when you're ready. I think from a neurological kind of perspective, we need certain chemicals in our brain to perform, to be motivated, to want to do things. And so clinical depression really is a marked change in having those chemicals that we need in our brain. So we typically are in a place where we have a serotonin depletion or a dopamine depletion or oxytocin, those types of things, which are all those feel-good chemicals that play such a huge role in us being able to maintain motivation and to get things done. And so if our brain is in a place where it doesn't have those things, it really is like that person is fighting an uphill battle to be able to stay motivated. And so if there is a depletion, that biological depletion, neurological depletion of those things in the brain, for whatever reason, the brain just isn't making enough of those things, we're going to see a marked change in how that person engages in the things that they do. And so as an adult, we're going to see a difference in how we perform at our job. And so a teenager doesn't have a job, maybe yet, some do, but not, a full-time job at least, probably. And so what we're going to see is we're going to see that change in their school. And we'll see that in their academic performance. We might even see it in any of the, if they were part of athletics or sports or something like that, that we would see a marked change in that too, where maybe they're not doing as well with it or they're not wanting to do it. And they're beginning to maybe express, that maybe they don't even know what's going on with themselves as far as I used to really like to do this and now I don't like to do it. I don't know what's going on. We talk a lot about the 7 pillars of health, which it's a lot to recite. I don't know if I could remember all 7 right off the top of my head right now, but it's going to be things like healthy nutrition, not something that teens are really great at. Also One of them is refraining from substances that might be risky substances, and then also getting adequate sleep. And so even though we might not see screen time as a substance, we know that our brain reacts and responds to it as if there is a substance on board. So the continuous dopamine pushes that we get from using an electronic device resets our brain to a different equilibrium, and balance. And so if we're constantly getting those pushes from our electronic devices, which they've been really good at developing that and creating that, what happens is that we almost teach our brain to need that constantly. And then if for some reason, the power goes out and the battery dies on our phone or whatever other device we don't have anymore, we feel that really acutely. We feel a lot like all of a sudden there's this thing that's missing. And so as a teenager is developing and growing, their brain is a little bit more at risk, because it really needs these things to develop well. And so if you're incorporating this device that you're using all the time, it could potentially slow that development down or mess with that development. So you're not getting all those things that you need to develop. I would say with everything, it's always balance. And so finding balanced times to have that. And that absolutely, because the teenage brain, the frontal lobe hasn't fully developed, that sort of thing, it's very difficult for somebody at that developmental level to be able to regulate in a healthy, balanced way that use. And so caregivers and parents, that really becomes our job to help them navigate that, like a lot of things in life, time and getting prepared. And so that electronic usage is another thing. And we might not begin to see that could be one of the warning signs of depression, is a desire to only do this one thing. That can be part of that isolative behavior. And I say it's kind of like if you're beginning to experience depression, or you think the kiddo might be depressed, increased usage of devices in that moment only makes you have to work a little bit harder to have to combat some of the depression that you might be feeling. And so we always say we want to hedge our bets to healthier, more well-balanced brain power, which means that I need to learn how to limit how much time I'm using my device. Our very first thing that we want to really pay attention to, and that can be really scary for a parent, is anytime we're beginning to hear or see self-harm or any behavior, talking about wanting to die, or the overwhelming sense of hopelessness, where I can't imagine what it would be like for me to continue living. We're in a really pretty serious place. And we probably want to, at that point, get assessed very quickly, if that's the case. And so, going to a walk-in crisis center or calling 988 talk is really important to be able to do that, so that you can have a professional who can take a look at that and say, okay, this is major depression, or this is a significant issue that needs to be treated. That's the very first thing we want to pay attention to. If we're beginning to notice a marked change, I think, the thing that as a parent, what we want to do is we want to fix things for our kiddos. And I think it's important, particularly for teenagers, to begin to learn how to manage things on their own with the support of us as a parent. And I always say asking more questions about what's going on. And if there's a resistance to talk about it, it might not be about them being oppositional. It just might mean that they're actually depressed. So not taking that personally, and maybe reflecting and validating that it's really hard for them to talk, and reassuring them that, hey, we're here and we're going to keep talking about this. You might not like it, and we're going to keep talking about this. And I want to find a time that feels good to you to talk about it as well. And having that kind of a conversation around it. I think you could start with the social support group, which is a great place to start. There's a lot of teen support type groups, even on campuses. A lot of schools offer them. And so helping them get connected with something that where they can talk openly. And it would just be a non-therapeutic level. That would be like your very first level. It's just a support group where there's not necessarily a treatment idea behind it, other than I'm just going to talk about my experience and be around other people who experience it. Typically, there's going to be people there who can actually mentor us and be a part of that. And so it's a really powerful part of the continuum of care. And that's really kind of where it starts. Having a really great support network. If things still don't change after really developing and creating that, then the next step would be finding somebody who could do a once weekly outpatient, as it's called, which would be a therapist. So that might be somebody who has a private practice. They might be part of a group practice, but you're seeing that person individually 1 hour per week. It might be every other week. It might be in person, or it could be virtual. And depending on the person, what feels best for them, those are all really great ways to get that care. So you tried that and you're still noticing that things aren't working, or maybe behaviors are a little bit more intense, that that condition just isn't being resolved. Then the next level would be something called intensive outpatient therapy. Intensive outpatient therapy takes the idea of groups, and we know that group is a very powerful way to address anxiety and depression and a lot of other potential problems of mental health. And so IOP would be typically half a day or 3 hours a day. That's the intensive part and you're going to do that multiple days per week. And it's really to zero in on and take a look at resolving those things. And usually they're going to be somewhere between the range of 12 to 16 weeks long. So it's somewhere between 3 and 4 months of this type of work. And then the next level would be PHP, which stands for partial hospitalization. And it's the kind of the same idea as IOP, except it's just a little bit more intense. It's 5 days a week typically, and you're going for more like 5 hours per day, maybe 5.5 hours per day. And it's going to be that intense group and I forgot to mention with IOP, it's also with individual sessions. It's going to include family sessions. And then another piece that would be a part of that would be medication management. So having a med provider who can work with the treatment team on really zeroing in and working on some of those needs. And partial hospitalization is really the same thing, those components. And then, but just with the increased intensity in the number of hours per day, the number of days per week. Typically, that's going to be a little bit shorter period of time. It's going to be like 8 weeks, 6 to 8 weeks for the PHP. And really the idea behind that is stabilizing. So this might be somebody who's maybe actually had some really significant suicidal gestures or suicidal behaviors that we're really concerned about. Maybe they're experiencing mood dysregulation that is so intense that they're not able to go to school. That would be that level of care would be PHP for that. And then another level is residential treatment, usually called RTC, Residential Treatment Center. And once again, short order, usually 1-2 months. There are some longer term residential programs as well that might be 3 months and more. And the focus on that is also stabilization. It's a person who has experienced so much disruption that they need a little bit more of a structured environment to keep them safe. And that those environments are designed to be extremely therapeutic and safe with safety in mind. There's lots of supervision and intensity in the level of treatment that person's getting. Would have medication management, family sessions, and individual sessions as well. And then the final level of care, the most intense, is something called inpatient. And that's usually something where it can be either voluntary or involuntary. And that basically means that this person, we are pretty certain that if this person were to live outside in the community, that they're in imminent risk of danger to themselves or somebody else. And so that's somebody who's maybe having some very intense urges to end their life. And so we want to put them in an environment where, once again, there's 24-hour supervision, and there's staff who are trained to do that. And there's a lot of medication management that goes with that. We call that inpatient as well. And we typically see that happening, could be anywhere from 3 days, 72 hours, to possibly a week or 2 weeks for adolescents. So that's the full continuum. The idea behind that is we always want to use the lowest level of intervention to fit the need. So as a parent, I might see something, I might get really scared, and I might be like, oh my goodness, my kid needs to go to inpatient. And we might go to a walk-in crisis center. They might call the talk line, and that professional might suggest something like, well, hey, you haven't really tried to start with any individual therapy or anything. You're not really seeing any really concerning behaviors. Let's get you connected with a therapist first. And the big thing is that there's not a plan to end life or to, those types of things. If we see a person with a plan and an ability to complete that plan, then probably that's an imminent risk, and we're going to want to get assessed for inpatient for that. I think oftentimes, we can have these conversations. It's not very intentional, and kind of what we're doing is we're setting ourselves up for failure with that. If we're waiting for things, until we're feeling escalated or extremely worried about something to have that conversation, it's not that we shouldn't have that conversation. It just means that we might not be as effective with that conversation. So I say, like a lot of things, early and often. Having that conversation, not waiting for things to escalate to have that conversation. Having it during times that maybe feel a little bit more natural. So it could be if, a team is, you take the team to school and you're riding together in the car. I think having those conversations in the car is a great time. And what can be helpful about that is there is a limited amount of time. There's bookends on that. That is only going to last 10 minutes, right? Because that's how long the ride takes. And that can be actually really helpful time to have those conversations. Paying attention to how you're sitting when you're having those conversations can be really helpful too. The great thing about the car conversation is that you're sitting next to each other side by side. That can be really helpful instead of face to face. That can feel a little overwhelming and intense at times. So paying attention, anything where, maybe we're sitting on the couch together watching our favorite show and we have a couple minutes to have that conversation. That's a great place too, because we're confrontational on how we do it. I would say that this is where it starts. I'm going to plug a book. It's called Anatomy of Peace, and it's about influencing change and how to address conflict. Oftentimes, we have a teenager who's feeling and experiencing a lot of depression and anxiety. There can also be a lot of conflict in the relationship. So Anatomy of Peace talks about how our heart needs to be at peace before we engage. And we really want to focus on helping things go right and spending a little amount of time correcting things that are going wrong. It's not that we don't correct things that are going wrong. So we want to focus more on helping things go right. So in that conversation, if we're needing to have a conversation with our team, we really need to make sure our heart is in the right place first. If I go walk into that conversation and I'm extremely dysregulated myself, then my team is probably going to follow my lead. And it really is important for me to be well regulated before I have that conversation. And I would say this, I think parenting is a high fail activity, particularly when your kiddo's a teen. I think being honest about that is okay. And just saying, you know what, like, I'm really struggling with how to have this conversation. I don't know how to have this conversation. I feel a little awkward and anxious myself about having this conversation with you. And I really care about you. And it's really important for us to figure this out. Can we sit down and talk about this? When's a good time to sit down and talk about this and figure this out? Inviting into that relationship to have that conversation. Oftentimes it feels like we're getting more wrong than we are right. That can feel really daunting. Go easy on yourself as a parent. Know that we typically don't have a lot of manuals and stuff on how to do everything. So go easy on yourself. Ask for help when you need it. And there's plenty of support out there for us as parents.